Welcome to painwhenurinating.org. Are you suffering from the effects of feeling pain every time you urinate? Fed up, depressed, with constantly thinking about urinating? Let's take a look at what may be causing your conditions. But first, let's take a look at how the urinary tract works. The urinary tract system consists of kidney, bladder, which is connected by a ureter. The kidney filters the blood and in the process produces urine, which passes down the ureter to the bladder. At this stage the urine is sterile, but an infection can work its way up the urethra into the bladder. Pain during urination may be a sign you have a bacterial infection, or it could also be a result of a sexual transmitted infection such as genital herpes. Another cause of painful urination is cystitis, or inflammation of the bladder's lining. Whatever's going on, you simply can't let it go on without some treatment, or you run the risk of permanent damage to your urinary tract system as urine begins to travel up from the bladder through the ureter tubes on into the kidneys. So what are the signs of a urinary infection? 1. Urinary urgency or frequency. Put simply, an urgent need to urinate can be defined as a desperate urge to go to the toilet without little or no warning whatsoever. Frequency, on the other hand, can be defined as needing the toilet more than 8 times a day. Urinary urgency is a sudden, compelling urge to urinate and increases with age. When it can become uncontrollable, it can even lead to urinary incontinence. Frequent urination describes a need to urinate more often than you usually do. There is no clear definition of frequency. However, you may be suffering from a frequent urination symptom if it is creating changes or hardships in your life, or if you develop a fear of being too far from a restroom, or if you need to plan regular stops en route. 2. An inability to empty the bladder. First, you need to understand that this varies from person to person. An adult will usually go to the toilet between 6 and 8 times a day, depending on the levels of fluids they drink. The bladder is rarely completely empty. Even having just relieved oneself, there is still on average about 10% of capacity left, called residual volume. Difficulty to pass urine or emptying the bladder can be very debilitating. In some cases, the sufferer can experience a condition known as retention, a feeling that the bladder is not emptying when they go to the toilet. This is a very stressful condition that may lead to the sufferer becoming unwilling to venture out of the house or to try out new activities because they don't know if toilets are closed or where to find them. For some unlucky people, they get to experience a combination of these two symptoms. 3. Pain during urinating. Urinary pain may be felt where the urine passes out of the body. A stinging sensation is very common, for example, or it may be felt inside the body, beyond the pubic bone, or in the bladder or prostate. Painful urination is a common sign of a urinary tract infection. UTIs can be caused by bacterial infection or inflammation anywhere along the urinary tract. Sometimes it's not a bacterial infection that's causing the problem, but a sexually transmitted infection, such as genital herpes, gonorrhea, or chlamydia. If you don't have any symptoms like fevers, pain in the side of the back, nausea, shaking or chills, then you may be suffering from a urinary tract infection. 4. Blood in the urine. Normally, the urine is a pale yellow colour. If on the other hand your urine is pink, red, brownish red or tea coloured, then you may have blood in your urine. One cannot readily distinguish between blood originating in the kidneys, urethra, the tubes that transport urine from the kidneys to the bladder, or urethra. Any degree of blood in the urine should be fully evaluated by a physician, even if it resolves spontaneously. Another common reason for blood in the urine is the presence of stones in the bladder or kidneys. These are crystals that form from the minerals in your urine, which develop inside your kidneys or bladder. Five, cloudy or foul-smelling urine. Normally, urine is clear and has a strawberry yellow colour. While the odour of urine can vary somewhat, in most cases it does not have a strong smell. However, with dehydration, the urine is more concentrated and may have a stronger ammonia scent than normal. The urine may also have an abnormal sweet odour in those who have uncontrolled diabetes. Also, some rare genetic conditions can also cause the urine to have an abnormal odour. Urine that has an exceptionally strong or foul odour could be a sign of urinary infection. Brown coloured urine is indicative of a liver problem, whilst pink, orange or red urine indicates blood somewhere in the urinary tract, any of which warrants a trip to your doctor. 6. Fevers, headaches, weaknesses and fatigue. Although strictly speaking a fever isn't associated with a urinary infection, most kidney problems start off at this point. Therefore, I have included this symptom in this group. That's because, as we've already seen, bacteria is able to migrate from the bladder to the kidneys quite easily. To continue, a fever develops when the immune system that helps protect us against disease is actively creating antibodies to help fight the infection. In some cases, an infection can become severe, particularly if the kidney becomes badly infected. It can become very serious, even life-threatening in a majority of cases, if for whatever reason treatment is delayed. Children who get a temperature without displaying any other symptoms should automatically be suspected of having an infection. This is why a urinary test is commonly done when a child is unwell. It is important to diagnose and treat a urine infection promptly.